Well, MedInsight really helps support the organization and its mission because it allows us to help identify opportunities for improving quality care of our patients, as well as unnecessary utilization and opportunities that we wouldn't have seen otherwise to improve the cost of care. One of the early examples of a success we had after we implemented was a project where we avoided unnecessary work with our physicians. For the past several years, we're working with the doctors to try really reducing inpatient utilization, because overall that's about a third of the medical spend. But once we implemented MedInsight, we actually realized most of our physicians are at or above the well-managed benchmark. So we were hitting a dead horse, for lack of a better term. And we realized a lot of the efforts we were putting in, not only on the IPA side, but on the physician side, wasn't giving us any benefit. So we were very quickly, within a month of implementation, switched gears. So we can actually start focusing on things that are meaningful for the physicians. Once we realized that the inpatient activity wasn't something we needed to chase after, we allocated resources on other projects. One that really started to pay off is looking at specialty utilization. We are a primary care organization. We have no specialists. But when we started looking at what specialists our patients were seeing, it was across the board. And a lot of times the physicians were not even aware that the patient was still seeing them. There was one diabetic patient the doctor referred to an endocrinologist 5 years ago, once they were newly diagnosed. That patient has been going back to the endocrinologist every quarter for the past 5 years, having their HbA1c measured. And that's it. There's no change to medication or anything else. And that is something the physician was not aware of. That forces a conversation between the primary and the patient about why are they still going to that specialist, and is that something that they should be doing within the primary care office. We also use MedInsight to help manage some of our contracts. We never had the ability to break it out by cost category before we had MedInsight. So we were able to, in our last round of contracts, we were actually able to look at the last 3 years of cost and utilization for each of those categories, and we could identify which ones were the PMPMs were changing because of utilization versus the cost. When the utilization went up, it was the physicians driving that activity. When it's the cost, it's the payers, and we have no control over that. So we were able to go into the negotiations on a much better footing about what we actually could control and what things we needed the payers to correct on our behalf. The reason we chose MedInsight over some of the other vendors that we looked at was primarily their history of actuarial knowledge, as well as their experience working directly with the payers. It's very nice when I'm talking about an inpatient stay or ED rates, and we're using exactly the same definitions that the payers are using. It's not, we're looking at these codes, but the payer's looking at something else. We're using the same platform, so the underlying information will tie out. The greatest value that value-based care insights has given us as an IPA is just knowledge that we are focusing in on opportunities that are meaningful to both our payer contracts as well as to our physicians. We're not having people chase things that, at the end of the day, do not improve quality of care or improving the cost of care for the payers. We're able to identify opportunities that, truthfully, we wouldn't have found otherwise, where we can refocus our efforts and help improve. Analytics is the future of our IPA strategy and plans going forward. We realize after we've implemented MedInsight how much we were missing without having a decent analytical platform to work on.